Femoral amputations do not imply the loss of walking capacity. Thanks to the use of a socket which joins the stump to the prosthesis, the patient is able to walk again. However, it may entail some complications. The patient will initially suffer gait alterations, with poorer balance and biomechanics, and may sometimes need to use walking sticks or crutches. The patient uses more oxygen and becomes tired more easily. The patient has poor control of the prosthesis. The patient will probably have problems with the stump due to changes in volume, sweating, problems with the socket, pain, etc. Finally, the femur suffers osteoporosis over time, and this increases the risk of fractures due to changes in the load transmission of the amputated limb. The prosthesis is subjected to axial pressure, which is caused by bearing weight on the heel. The pressure is transmitted to the socket base and continues up through the walls of the socket towards the ischium and then to the spine. The femur is hardly involved in this process, as the bony end of the stump does not rest on the socket. However, the femur does take part in the load transmission in healthy legs. Since the affected femur supports no weight, it develops osteoporosis, which weakens it and increases the possibility of hip fractures due to falls. The Keep Walking implant reduces these problems for amputees and improves prosthesis control. The implant is surgically inserted into the femoral canal, taking from 45 to 65 minutes. Such surgery can be carried out in patients who have already undergone amputation or at the same time as the amputation procedure. Since a larger rigid contact surface is available, the stump can therefore directly lean on the femoral socket. This is the so-called distal support, which is similar to that existing in patients with knee disarticulations. Distal support provides patients with a number of advantages. Patients improve their biomechanics and need less support for walking. Patient resistance increases, so patients can walk more quickly and for longer, thereby increasing their autonomy. Greater control of the prosthesis. The patient has greater feel and control of the prosthesis, therefore making walking safer. Less discomfort in the stump, as the socket no longer leans on the ischium, so the prosthesis can be worn for longer. Openings can be made in the socket to make it more comfortable. Improvement regarding osteoporosis of the femur, as the latter now participates in the load transmission. Accordingly, bone mineral density is recovered.